Hi, I'm Dan Weberg. I'm the head of clinical innovation at Trusted Health, and I have a passion for innovation and change in healthcare. So nurses are natural innovators because they're the connectors of the whole system. So everything goes through the nurse, and they coordinate from the clinical care to the community care to the technology. They are the interface of all of that. And so when you have that system view, it puts you in the perfect position for innovation. If you're siloed into one thing, you kind of lose track and you're not able to kind of see the world and get new ideas in. And nurses interact with so many pieces of the system, they're able to bring that in and be innovators. So the problem with nursing is we like to do it behind the scenes. We're the positive deviants and the workaround gurus, but we never bubble that up into like ideas and actually implement them. And so I think nurses can do a better job of that, but being that connector just gives us the viewpoint to actually shift the healthcare system from this kind of point solution, fragmented model that it's in now to an actual coordinated system, and I think that's where innovation is moving the whole system. Some of the barriers I see right now are the health systems aren't really set up to allow frontline people to innovate. And so there's a study that came out of Ohio State recently that showed nurse managers are the #1 barrier to change in health systems. And until that changes, it's hard to bubble up innovation from the front lines because it's stopping exactly where it's starting. And so we need to do better about leadership training. I think a lot of times we promote people that are good clinicians into leadership positions. They're very different skill sets. And so we need to be better about leadership training, competency, those type of things. And then I think the other barrier is workforce. So we're a very shift mentality profession right now. And we go home, we do our 12-hour shifts and we go home and we don't think about work, or we try not to. And so I think being able to own our profession and understanding that you're a nurse 24/7, even if you're not in the hospital, and taking that extra time that we have off now, if we're working 3/12s, we have 4 days to think about innovation and do other things. So what are those side gigs or those other impacts we can make in the healthcare system when we're not at the bedside? I think just shifting the framework of how nurses think about their professional life is another way that we can actually move the ball forward on innovation as well. So nursing schools have a big opportunity to actually engage in innovation and build the next generation of leaders. So I think there's a couple ways that schools are conceptualizing innovation. One is entrepreneurship, and that's a small segment of people that are gonna actually go off and start their own company. But there's a good skill set and it's very unique, and so there's an opportunity to build curriculum around how do you actually start a business as a professional, what are the risks, how do you do it, what are the opportunities, those type of things, business planning, venture capital, all those things that no one has an idea because they want to go be a nurse, but there's an opportunity to teach that. I think the other piece is entrepreneurship. So how do you go into an existing system and actually design something new, a new department, a new service line, all those type of things. And then there's I don't want to do either one of those. I just want to be a nurse and be innovative. And I think the skill set of change and understanding organizational culture and how to influence people, how the adoption curve of innovation happens is a key skill set that nurses should have all the way through, from undergrad to PhD. And the reason I say that is because we teach all our doctoral students, our bachelor students, our master students about evidence-based practice, and we give them all the tools to assess practice and get the best evidence. And then we don't equip them well enough to actually create that change in a health system. And so we got to get better about change science, about all the literature around diffusion of innovation and complex systems, and all this research that's comes out of business about how businesses enter markets and change things. All of that's really relevant to the frontline nurse and how they can adapt their practice to the future of healthcare. So I started in innovation really at the College of Nursing at Arizona State University. I started with the simulation mannequins. They were still in the closet, and I wanted to figure out in my senior project how to program them. So I pulled them out of the closet and spent about 2 weeks in a room with SimMan. And I learned how to program him. And that was my entree into healthcare and kind of pushing the walls of what was being done. And went it helped them build the big simulation center, and then they had a master's in healthcare innovation program, and I thought I was going to go build a simulator. And I quickly found out it was a leadership program, and I had no idea. And I fell in love with the content. I fell in love with the idea that you could change healthcare through leadership and influence. And it was similar to in the movie The Matrix, taking that blue pill and just understanding that the world is different, and you just open your eyes to all the things that are able to be changed. And so I did that program and just opened my eyes, and then I did the PhD program right after. I was the only student in that PhD program. Got mentored by two of the most amazing leaders in healthcare innovation, Tim Porter-Grady and Kathy Malik. And then I was just always an early adopter. I was the one on the nursing unit with technology in my hand before EMRs were even there, and just continued to do that and got really passionate about leading change and had opportunities to do that throughout. Jumped into Kaiser Permanente and was able to really dive deep with some of the cool technology companies, Google's, Apple's, startups, that kind of stuff. And that really catalyzed my understanding of how we could disrupt healthcare, and then just kind of built on that from there. And then joined a startup because why not? If you're going to lead innovation, that's the place where it's happening right now. So decided to jump over and join Trusted Health to try and do that.